Thank you very much. And good evening or good afternoon. Thank you for coming here tonight. Happy St. Patrick's Day to those who are celebrating on March 17th, 2026. I am here with Ginger Cloud, and we are here for about the next 30 minutes to talk about the upcoming ketamine-assisted psychotherapy training. This is a new professional certificate from the University of Vermont Professional and Continuing Education, or PACE. And thank you again for coming here to learn more about it. I also want to let you know that the chat function is turned off, but we have a Q&A function. So if you have questions, you can enter that into the Q&A, and then either somebody behind the scenes, Lauren, may respond, or depending on how the presentation goes, we can stop and answer questions as we go, or there'll also be time for questions at the end. Also, this is recorded, and so everybody who registered will get an email with a link to the recording, and it will also be on our website. So those others who have questions or want to come back to see can. So we're going to first talk about the agenda, what we're going to be talking about for the next half an hour. I'm going to introduce to you Ginger Cloud, and she is the course developer and also the instructor for this course. She's going to tell you a bit about herself, how she came to this work, and why she wanted to teach it to others. Then we'll talk about what is ketamine-assisted psychotherapy training and what you'll be doing in this professional certificate. I know that this can be like a somewhat new topic for many, whereas others maybe already have some knowledge in this field, but it is a growing field, and we're hearing more about it, and we're excited to have an offering in it. We'll then talk about prospective students. So who are some of the people who this course was made for? And maybe if you're wondering, is this the right course for me? That will be an opportunity for us to go over that. And then we'll have some frequently asked questions. We can go over what online learning looks like, what you'll be doing in this course, what you can expect, on a weekly basis. And then time for questions, live questions that maybe we hadn't answered yet. So without much further ado, I'm going to introduce Ginger Cloud and mute myself for a little bit and have Ginger talk to you all.
Ginger. Thank you so much, Jessica. And just want to honor and thank PACE for being courageous and offering this course on ketamine-assisted psychotherapy. It's so nice to have UVM really taking a lead and making sure that clinicians have a thoughtful, rigorous course to participate in that can help them often in private practice. And so it's a continuing education and professional development. And so allowing us space to explore how to work with these strong new modalities in a safe and effective way. So just a lot of gratitude.
Thank you.
So my name is Ginger Cloud. I have a license in mental health counseling, a clinical mental health counselor, and also an alcohol and drug counselor. And I've also completed a year-long intensive on psychedelic-assisted therapy training through IPI, which is out in Boulder, Colorado, which is the Integrative Psychiatry Institute. As some of you might know, there's a lot of different programs that have been bubbling up over the last 5 years across the country, really internationally, on psychedelic-assisted psychotherapy. And often ketamine is included in those trainings. And this training really is specific to ketamine-assisted psychotherapy. Myself, I've been exploring psychedelics for probably the last 30 years and involved in the different waves, I would say, of psychedelics coming into practice, from psychedelic peer support to community conversations on psychedelics to now more being able to integrate this modality of treatment into clinical practice, which is really exciting. And for me as a licensed clinician, it's so important to be maintaining my license and with integrity and with thoughtful ethics. And so for me, that's really just practicing with ketamine at this point because it's legal and available. So my background is really rooted in Buddhist psychology perspectives and really looking at our interconnectedness with each other and with the natural world, as well as sensory motor therapy practices, as well as internal family systems and other behavioral-based practices. And so that's going to be my perspective I bring in. However, one of the most beautiful things about ketamine-assisted psychotherapy is regardless of what lens you bring to it within your own orientation, the medicine really serves as this catalyst that opens a space for great healing. And so if you're not trained in IFS, that's okay. Or, whatever training that you've really steeped yourself in and cultivated, I imagine you will find useful application with this medicine as well.
Thank you, Ginger.
Yeah.
I was going to take us to the next slide about what is ketamine-assisted psychotherapy, and also just highlight some of the things that you just said in your introduction in terms of how there's psychedelic-assisted therapy is a broader topic that can involve other types of substances, but ketamine is currently legal. Is it across the U.S.?
Yeah.
Yep.
Yeah. Mm-hmm.
And a growing field, a growing modality. So could you please tell us more about what's involved in ketamine-assisted psychotherapy?
Yeah. And so it really looks different depending on the platform or the location or the office setting that it's in. And these are all things that we're going to explore in the course together as well. And so there's ketamine-assisted psychotherapy, where our main focus is really looking at practice within a private practice setting where a therapist is engaging with a client in person. Ideally, certainly telehealth is an option. Um, and so people are prescribed ketamine by a medical professional. So they go through a medical evaluation to make sure eligibility criteria is met. And then also looking at psychological evaluation to make sure it's going to be a safe medicine for people to explore. And so we'll be going through these things in the course. And we usually think about this model within ketamine-assisted psychotherapy and psychedelic-assisted psychotherapy, where it's this frame where people are engaging in preparation. So sessions to help them prepare to be in a place that hopefully the most therapeutically advantaged spot to be able to benefit from a medicine like ketamine. And then there's the medicine sessions themselves, which are in this model that we're going to be talking a lot about, are these supported medicine sessions. So within the context of a session with a therapist that's not a licensed medical professional, a client would self-administer the medicine in office. And so making sure to think about how to make that a safe experience for both the clinician, right, and for the client, and also the collaboratively safe with your medical prescriber, that you're helping create this container of very powerful therapeutic work. And then that's usually followed by integration sessions. So what we think about with integration is, how do we help the client integrate or translate the information that they receive, the insights, the sense experiences that they received into changes in their daily living and functioning. Yeah. And so
Fascinating. Yeah. Go on.
Yeah. So that's kind of like the main model. However, because this is very much of, what we want to call it cutting edge or just new, it's really in its infancy. There are so many different ways to approach this work. Some people are receiving ketamine through like a mail order subscription. So they're getting ketamine sent to their house, and then they're kind of exploring ketamine on their own, or maybe with some telehealth support. And so we'll be covering what that looks like. How do we have safe practices if that's the case? What to be aware of, really, that comes from mishaps. I think we have our greatest learning through error, and kind of seeing what doesn't go well maybe, and then we can reapproach and then hopefully share that information. That's one thing I love about teaching, is it gives us space to talk about like what didn't go well and how to make it better. So we're all hopefully approaching these modalities of treatment with as much care and tenderness as we can, because as we know, where there's great potential for healing, there's also great potential for harm. And so, how do we help people be safe as they explore these modalities of treatment? We will talk some about like ketamine clinics and that medical model of ketamine administration, how to be supportive if you have clients that are exploring that as a route of therapy, and how to support them with preparation or integration, or even going with them to an IV clinic for medicine sessions. Um, and the other element is there's a lot of retreats, there's a lot of training programs out there where people might engage for like a week intensive, out in Colorado or somewhere, or Boston, or they might do a weekend long intensive training on ketamine-assisted psychotherapy. And all those are really wonderful. And even the year-long program I did and the experiential on Colorado, wonderful experience. I will say though, I wasn't prepared for what it is to actually integrate this into rural private practice setting. A lot of the models that are taught from, I'd say across the country, really come from a perspective of this integrated clinic, which is awesome, right? That these things exist. They're not quite here in Vermont, but these integrated clinics where you have a medical professional on site, where the psychotherapy is just part of the package, and everything's so seamlessly woven together that it really portrays a kind of a fluid easiness, in a sense, or this ease about the work. And what I found in private practice is I wasn't really equipped after those longer, the year long, or even folks that I've talked to that do the more brief intensive trainings aren't really equipped to know how to integrate that into their practice.
Yeah,
But
thank
yeah,
you.
this program hopes to do that.
And I think you really just demonstrated why we're so lucky to have you as well, because not only of your experience with this topic, but the care that you put into these ethical considerations and the various scenarios that can happen, and trying to prepare as best as one can for those types of situations. So you explained how in this course, students are going to learn various ways to support patients or clients who are seeking legal ketamine from their medical prescribers to use during therapy sessions. This next slide is going over some of the learning outcomes of the
Yeah.
course. So if you want to, and when we say CAP, we're using that as an acronym for ketamine-assisted psychotherapy, which can be a mouthful. But
Yeah.
if you want to also kind of highlight some of these skills that students will gain from the course.
Yeah. And definitely. And so we'll get right to this slide, and I'll try not to be too long-winded. I just want to say that last slide, some of you might have read some of those stats, which are really impressive, right? And so that's one of the things, right? These headlines that we're seeing about these different types of medicine. I mean, 75% reduction in postpartum depression within 42 days, right? With mothers that really have significant depression and prenatal, right? And a single low dose of esketamine making this huge difference. And so it's really exciting. And something to think about too is a lot of these big headlines do focus on folks that have more severe and persistent mental health struggles. And so often in private practice, what we're going to be seeing is really people more in the mild to moderate level of severity. And then if we're seeing people with more moderate to severe, that's where we're really wrapping around with support, where they're at probably a higher level of care, potentially at an IV clinic or other situations where they're going to have more wraparound support. And so there's just such a big continuum of how we approach this practice, and finding your footsteps that feel safe for you is really important, and kind of knowing like what's appropriate for me in private practice versus more of an integrated clinic setting. And if that doesn't exist yet in Vermont, say, or maybe in your rural state, how do we help build that? Like what's important as we seek to build these safe places for people to explore these medicines, both as a clinician and as for clients. And certainly medical folks, and I know we'll get into this, there is a place for you in this course as well. So we can hop back over to that other slide. I just wanted to address that. Yeah, so what we're hoping for, right, by the completion of this course is really you should be able to integrate CAP into your practice if you want to. And I say that because some people go through a course of around ketamine-assisted psychotherapy, and you might say, you know what, this feels like too much for me to sit with, or I'm not sure how to add this to my practice. I will tell you, though, however, that regardless of if you plan to practice ketamine-assisted psychotherapy in your practice, there are so many clients in our community engaged in this medicine work. And so for you to really have a sense of what does it even mean to do this work? What are some of the educational, informational items I can bring to clients to help make sure the course of ketamine they're pursuing is safe and going to be as therapeutic as possible for them? What do I need to know as a clinician to make sure I'm giving appropriate, up-to-date information based in science, right? And based in what is kind of happening, and what things do I really need to be concerned about if they're potentially looking at a mail order subscription that might be counter to some of their past addiction history or other things that would raise concerns about the therapeutic potential and benefit. How to notice those things, how to reduce risk and mitigate risk associated with this practice is all just really good to know. So either way, if you might integrate it into your practice, you might just be more knowledgeable, which is really important to practice ethically right now as these medicines are on the scene. So we're going to be defining ketamine as a therapeutic intervention, both what ketamine therapy looks like, what ketamine-assisted psychotherapy looks like. You're going to have time to create a CAP-specific informed consent that then you can use in your practice if you choose to integrate this into your practice. And even if you don't, you'll know like what you should be looking for. Like if you're referring out to a clinician that engages folks with ketamine-assisted psychotherapy, you'll know what questions to ask your client around, did you cover this? Do you know what you're going to be expecting? Or do you know what might come up during a session? And how is integration going to look for you too? And you'll be able to support the process in a more thoughtful, cohesive way. We're going to go over what needs to be in the psychological assessment for a potential evaluation for CAP and to prepare clients for CAP treatment. Right, the more support, and I think the more we're talking about this and with accurate information, the greater benefit for our clients and for each other as clinicians as well. We're going to look at maintaining safe and supportive medicine sessions, understanding basic integration techniques, and so we'll come at it from different perspectives and be able to think about novel ideas and how to help a novel idea be a safe idea. And a lot of times that's through collaboration. I might think something sounds really great and then want to practice it with a client, but really, right, before I practice that, I need to be getting collaborative input from colleagues to say, what am I missing? You know, what are my blind spots with this? And does this sound like this could be beneficial therapeutically before I introduce anything to a client? So there's little doggies in the background. Let's see here. And then build clinician supports for your CAP practice, right? So how do we move forward in a supported, cohesive way?
And I don't hear the dogs, so we may
Oh,
not
good.
even be hearing them. That sometimes happens, on the screen. I'm noticing I'm getting a green look up from my camera on the green screens, which is maybe going along with the St. Patrick's Day theme. So, we just roll
Body.
with it. But so we talked about what ketamine assisted therapy, psychotherapy is, and what the potential students would be, looking for and what they can expect to get from the course. Um, who are some of our prospective students? Tell us a little bit, uh, as I'm sure some who are listening tonight are wondering, like, is
Yeah,
this, some may know this is, they've already known about this. They're looking to find ways to support their clients, to
yeah,
gain information about a new treatment that they may not feel confident about, one way or another. Others, maybe they're just learning about this and wondering, is this something that I should be learning about? Is this something that
yeah,
my clients are going to be asking me about?
yeah. Excellent. Yeah. So, as a mental health therapist, I really, this course, I would say, is heavily oriented towards therapists
Mhm.
in private practice or in could be a clinic setting that you're hoping to bring this medicine into. There's all sorts of areas within the mental health field that this course will be helpful. I would say for folks like psychiatrists and physicians, it would probably be very helpful to understand what is happening in the therapeutic office or what should be happening in a therapeutic office if I have decided to write a prescription, if I think that there's a good eligibility fit for this medicine and this patient would benefit from these services. I want to make sure, right, that the psychotherapy that they're getting is good, that the clinician is trained. What kind of collaborative care agreements should I have in place to protect each party, both physician and the mental health clinician, so that we're working as a solid team, and that there's not all these unknowns, like, oh, I send this person over here, not sure exactly what happens.
Mhm.
So there's a lot around transparency and gaining an understanding of what an ideal practice would look like. And then there's real life too, of course. But we're really looking for an ideal practice and looking at patient safety. Um, as a nurse practitioner, psychiatric nurse, mental health practitioners as well. A lot of folks are doing this work, and they might be thinking about integrating like Spravato into their treatment or looking at, which is a FDA approved nasal spray that is covered by insurance. And so might be looking at different ways that they want to start introducing these medicine elements into their practice, as well as folks that, like, some psychiatrists do psychotherapy too, right? And some nurse practitioners, especially psychiatric mental health nurse practitioners, also engage the psychotherapy element. And so the one thing I love about this field is it really does build on collaboration among colleagues and really brings in more support from our networks. And so, yeah, I think there is a place for all of these disciplines, with the understanding there is a heavy emphasis on ethics. And so you certainly could provide the lens of whatever your ethical codes are and agreements. And also, you'll get a good understanding of what are the ethical codes associated with mental health clinicians and how you might better recognize if there is something unethical going on. Because unfortunately, in all of our professions, unethical things happen all the time. And it's something that we need to be aware of and talking about and raise concerns if we have them.
Thank you. So yeah, various members of a care team
Yeah.
I feel like is what was what you've outlined. These other screens, I get a
Yeah.
bright white side.
I
I've got a big screen ahead of me. Um, to go over just some of the facts, the data, the info about this offering and this professional certificate. Um, what we're going to talk a little bit more about finally is what it looks like, what online learning looks like, because this is 100% online. That means that there is not a set time that the class takes place or a date, and students are able to fit it into their schedule. It's 8 weeks starting April 13th. So that's in a little less than a month, and registration even sooner. So by April 6th, a tuition of $14.50. And then there's continuing education credits and a professional certificate as well that students will receive. And we can go over a little bit of this in our FAQs. And so these are some of the common questions that students have when taking a course with professional and continuing education. So, Ginger, if you wouldn't mind, telling us like what is a typical week? So this is an 8-week course. What can a potential student expect for, week by week?
Right. Yeah. So this is fully online, which is wonderful. People can expect to engage for about 10 hours a week in the material. So we try to build the program so there's about 10 hours of a week of content that you'll be exploring. And the platform, if you haven't done a fully online course before, the platform is really smooth and it's really, I think, pleasing aesthetically as well. And so you get brought in each week, has a number of videos, and there's some reading, there's interviews, there's knowledge checks, there's ethical dilemmas that we'll work on and discuss as a group. And there's also different ways to engage with other people in the course, whether that's through the discussion board or through assignments that we'll be exploring. And I know there's that next question around live sessions.
Yeah, are there live
Yeah.
sessions?
Yeah. And so a really wonderful thing too is every week, I think it's on Wednesdays from 6:30 to 7:30, there's an office hour. And so that's a space for students. I'll be there, and it's a really wonderful space to talk, to bring up questions, to practice. And so, things we're going to be doing throughout this course is, right? Like, what does a prep session look like and how do I practice it? And so these are going to be really nice areas where we can break out into, uh, use the breakout rooms, break out into groups, into dyads, practice what is it like to ask these questions? What is it like to practice helping someone understand all the different elements that we want to be considerate of when during a preparation session? How might we practice integration? How might we uh, sit for medicine session? Ketamine medicine sessions are about 3 hours long. So, what to do during that time, right? And we'll also play around with playlists and have a lot of space for experiential learning in those office hours. So I think those are going to really be a fruitful space to ask questions and to feel more confident in this work because it is deep work. Yeah.
And so you'll have the office hours, and I think you mentioned discussion boards, but how else will there be interaction within the course?
Yeah. Well, that's a great question. And I would really encourage, there are certain times that I encourage people to connect and to practice outside of the office
Okay.
hours as well, to really build relationships. Because one thing I've noticed in different cohorts that I've been a part of in these types of training is often people might create like a single signal group or a text group. And it's a great place to really start building those collaborations regardless of even if you're in the same state or not, because what you're going to find is you are a wealth of knowledge and you have so much that you're bringing to this course and to each other that it's really fostering these greater nets of connection and holding as we move into this work. And it's a great way to ask questions of like, oh, yeah, I heard this happen. How would you handle this? Or, this came up. What should I do? And so we're really looking at building this wider net of community as well.
I think that's a great thing to outline as well, is that this is a cohort
Mhm.
model, so that, a course of up to 20 students will be enrolling in each offering of the course and going through that 8 weeks together. And so you mentioned that it's an estimate of about 10 hours per week that a student can expect to spend doing the readings, watching videos, engaging in office hours or otherwise. Um, can you tell us a little bit more about online courses? So, how exactly do they access this, and are there set, due dates?
Mm. Yeah. Yeah.
You mentioned bright space is very
Right.
smooth. What is bright space, if you
Yeah,
can tell
so
us?
yeah, Bright Space is our platform that we teach from, and so it's very easy to use. There's a nice grading rubric, so you have a clear sense of what are the assignments, how much do they count towards my grade. This is a, a graded course, and often with CEUs, you have to get a certain percent, I think it's 70 or above to pass. And so that's something to be aware of, right? There are assignments each week to do and to turn in. And with that, there's some flexibility. Of course, no one, don't wait till the end, of course, to turn things in. We do want people to keep the pace of the group to really be engaged and get the most out of this course. However, there is some flexibility. We want you to be successful, and if you need an extra couple days for an assignment, there's flexibility. We really are working on you being successful within this work and engaged. So things are graded. It's broken up in this course. 50% of your grade is towards assignments and 50% is towards discussion. And so we really do prioritize engagement on, so there's like a forum, a discussion board where folks will introduce themselves, and then there'll be certain assignments that are posting questions to the discussion board or reading through and responding to someone's um, response to something in the course, or a question that someone might have, or a question that you're left with in response to something someone else said. And so there's really this popcorny wonderful way to interact with each other. And of course I'll chime in as well. And there's that office hour when you really just want some face to face support to explore things that are of concern.
We can
Yeah.
see if there are any questions from the audience. We're bumping up. We're just bumping up against our time. But what will I receive at the completion of the course? I just want to note that this is a non-credit course. So this isn't a credit UVM course. You don't have to apply to a program. You registered, as you were noting. These are adults, often working adults, engaging in this course. But so, what do they receive at the conclusion of the 8 weeks?
Yeah, and I think Lauren might have answered this in
Oh, okay.
um yeah, so you get I think it's like
In
a
the Q&A.
certificate. It's a
Mhm.
certificate, so it's not some courses, there's no real certifying body for this
Mhm.
work. And so you get a certificate that says that you completed X number of hours. So this is an 8 weeks course, about 10. So it's 2 credits. I think for most licensing board, 2 credits translate to about 30 continuing education hours. You certainly will be doing more than 30. So it really depends on your uh, licensing board and how much you put in to get approved.
Okay, great. So online certificate of completion for this professional certificate. You'll also get CEU's continuing education units from UVM, from PACE. And so our final slide is your questions. So we'll see in the question and answer if any questions remain that weren't answered. Thank you to Lauren, who was answering them in the chat. Thank you so much to Ginger. I'm going to put this slide on as well for anybody who would like to explore the course or register for the course. We have our go.uvm.edu/CAP training. So please do visit there. There's also opportunities to get in touch with us via live chat sometimes, or emailing learn@uvm.edu.
Yeah. I might just, oh,
Oh no, go,
yeah.
please.
I just saw a question in there around advertising, and I think that's such a great question. So I think, we don't have a specific module, I would say, on advertising, but really we have a lot that covers how to practice and set up a collaborative care model within your practice to network and coordinate with other clinicians. And especially with this work, it really comes, I think there's a lot of advertising that is done through how well your practice is set up and how uh, ethically sound and thoughtful your approaches with this medicine and this kind of work. And so going through, I think, a course like this is actually really good advertising for you. And you'll be able to market yourself in a way that I think is very rooted in stability and a solid foundation for being a clinician in this field.
Great. And I just want to highlight that the question was, will there be discussion or insight into advertising and targeting potential clients for ketamine-assisted psychotherapy? So just in case, I don't know if the chat will come through in the recording.
All right. Thank you.
So saying that taking this course is an excellent way
Yeah.
to advertise oneself as it being a specialized skill. And then another question in the chat is, what's an example of an assignment for this course?
Yeah. So each week we're looking at different ethical dilemmas that have happened in practice. And so looking at how to think about it, how to approach it, different ethical codes of ethics that might be in violation or potentially violated, uh, depending on the circumstances. Um, so ethical dilemmas is big. We get into those a lot. Another assignment is creating your CAP informed consent document. Another assignment is creating a safety protocol, and that'll vary depending on your professional background and what your expertise area is and licensure area. We also are looking at creating these collaborative care agreements. So most of the assignments, I would say, are kind of the concrete foundational paperwork that you really want to have in order to practice this modality. Looking at malpractice insurance, who's providing that, and what are some of the things that you can do to mitigate risk associated with this field.
Well, thank you so much again, Ginger. I'm noticing that we're over time, and so I want to leave this final slide again with the website, because if there are any questions that remain, maybe they're on our website. We have a more complete FAQ section, and as I mentioned, we also have other ways to get in touch in case there are specific questions that we didn't get to answer tonight or on our website. I am so excited that we created this course. I am so excited that we got Ginger Cloud to create it and here to teach it. And I look forward to its inaugural running next month. Thank you, everyone, for
Thank you.
spending part of your St. Patrick's Day with us this evening or for viewing at a later time. And thank you again, Ginger.